Good afternoon. Welcome to Waco City Hall, the third floor conference room for our weekly press conference that we bring you information about COVID-19 and the city's response. I'm Larry Holsey, Director of Municipal Information and Communication for the city, and I'll be the moderator for this program. In a minute, I will introduce our guest, but before we get that, I always want to remind you that we're doing everything we can to communicate with everybody in our city that needs to know this information. We have an American Sign Language translator inserting the right-hand corner, as you see, the sign language in on the broadcast that we're doing. That's originating from our studios downstairs. Also in our studio is a Spanish interpreter, and we're recording an audio track in Spanish of the entire proceedings. And always so gracious to be here. The part of our introductory here is Council Member and Mayor Pro Tem Hector Sabito, who will introduce and invite our Spanish-speaking audience for the 4:30 replay this afternoon on our channel. Hector, thank you for being here. Would you take it?
Good afternoon, Larry. Thank you so much. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en wccc.tv. Larry, thank you again.
Thank you as always. Thank you, Hector. Joining me today again are the panelists that we count on and have the great information we're going to share. We have Waco Mayor Dylan Meek, McLennan County Judge Scott Felton, Dr. Jackson Griggs, CEO of the Family Health Center, Dr. Brian Becker, Chief Medical Officer for Ascension Providence, and Dr. Umad Ahmad, Interim Chief Medical Officer for Baylor Scott and White. Gentlemen, thank you all for taking time to come and provide information I know that you all deal with every day, and you've done some research in preparation for our press conference. We're going to ask each one of you to make statements, and then we'll open it. We do have 5 representatives from the media on our conference today. Then we'll allow them to ask 2 questions each. But let's start with the opening comments. We're going to go in a different order this time. We're going to start with Mayor Meek. Then we're going to follow that with Judge Scott Felton. Then Dr. Jackson Griggs, the CEO of Family Health Center. Then we'll go to Dr. Umad Ahmad, Interim Medical Officer for Baylor Scott and White. And then we'll end up with Dr. Brian Becker, Chief Medical Officer for Ascension Providence. So Mayor Meek, I'll let you take it over.
Good afternoon, and I appreciate everyone for taking time to join us today. And thanks for all who are on this call. Right now, as hospitalization rates continue to climb in McLennan County, and our health district and city staff members are working around the clock while exercising care and compassion and are undoubtedly exhausted, I just want to say thank you. Thank you to our healthcare providers, to our doctors, our nurses, everyone who's working on our public vaccination clinic and administering vaccinations in the private sector. I want to urge our community to thank nurses, doctors, healthcare providers, and public servants who are working hard and around the clock as we begin to see a glimmer of light at the end of this dark tunnel that we've been walking down. Our local hospital systems, our city staff, our county judge, and myself are in close, regular contact with one another as we discuss and monitor data regarding our hospital capacity, hospital personnel, and monitor whether or not there will be a need for some sort of alternative care site. And to date, this seems to be more improbable than probable. Our hospitals and our Waco-McLennan County Office of Emergency Management have developed robust plans to keep our population safe should the number of hospital patients continue to increase to a degree of serious alarm. Our local doctors continue to advise us of the seriousness of this virus, and I urge our community to make wise decisions in the days ahead by following the doctors who will undoubtedly say on this call to continue to wear masks in public, follow safe distancing protocols, and wash hands. Following the doctor-endorsed protocol makes the situation not fearful. As a reminder, at the present time, Texas mayors and local governments have almost no control on policy-making authority. Governor Abbott has implemented and has control of the regulations and mandates, from wearing masks to closures of bars and occupancy requirements of businesses. The governor has issued an order stating that we can't issue an order that's more restrictive than his, and we have not heard any word from the governor's office that this might change. The Waco-McLennan County Emergency Operations Center is working with the Texas Department of Emergency Management and the docs health testing to provide free COVID testing to our community. Please continue to go to covidwaco.com for more information about the free testing that is available in our town. The Waco-McLennan County Office of Emergency Management previously received a refrigerated trailer to be used as a temporary morgue, and this refrigerated truck is currently housing 12 remains. Despite this very dark news, this is still a time for hope. This past weekend, Governor Abbott and the Texas Department of State and Health Services announced the Waco-McLennan County Public Health District would be one of 28 providers designated as a large site or hub for vaccination efforts. On Sunday, following their press release, we announced our local clinic and made 1,500 vaccine appointments available. Today, we are on day 2 of the first public vaccine clinic here in McLennan County and are so glad to see community interest and participation in this first round. As of 11 a.m. this morning, 554 people have received vaccines and there are 960 left to serve with appointments for this clinic. We are so grateful for the community partners who have helped the health district team to make this vaccine clinic a success thus far. This includes the MCC School of Nursing, the Waco Fire Department, Waco Police Department, AMR EMS Services, the Waco Convention Center team, the Waco IT Department and Waco Municipal Information Office, and the Waco-McLennan County Office of Emergency Management. This past weekend, the announcement of appointment availability was made to individuals who had registered for the COVID email newsletter available on covidwaco.com, by social media accounts for both the health district and the Waco Public Information, and through a press release to local media outlets, including newspaper, radio, and television stations. When we receive our next shipment, we will announce registration well before opening the appointment availability so that people have time to prepare to register. The registration portal will be made available both online and by phone. There are communications efforts and plans in place to better reach our entire community, including those who might not have internet, transportation, or healthcare access. These conversations are in process and ongoing, and we will continue to work with our staff and community partners to best serve our entire community. COVIDWaco.com continues to be our central resource for COVID-19 and vaccine information. This week, the city activated a public information hotline that residents without email, social media, or internet access can call into to receive the latest updates on testing sites, vaccine availability, or other COVID-19 information. Recorded messages are available in English and in Spanish and are updated as information becomes available. This hotline can be accessed by calling 254-750-5606. A vaccine survey will be available on covidwaco.com after this press conference to help better gauge community interest in the vaccine and assess how much vaccine is still needed for our community. Please help us by filling out this survey and encouraging those you know how to do so as well. We understand that the COVID-19 vaccine is in high demand and short supply, and that is disappointing for people who are not able to get an appointment. The Department of State Health Services has committed to providing Waco and McLennan County with additional allocations of the vaccine, and we will continue to host vaccination clinics as these shipments come in. Our planning and preparedness staff and our community partners have shown this week that we will have the capability to run this clinic well, and we are confident in our ability to continue to bring this service to the community. This is very good news. Again, a time for hope in our community. I'm so thankful for all of those who've come together around this cause, and I do believe that this is hopefully the beginning of the end of what has been a very long road that we've all walked. Again, I'm thankful for the participants of this panel today. Look forward to hearing from the other panelists. And as we mourn with those who have lost loved ones as a result of this difficult virus, as we hold close, or at least in our hearts, the people who have walked hard roads as it relates to this virus, the promise of the vaccine distributions does show that there are brighter days ahead. So with that, I will turn it now to back to Larry and the rest of this panel.
Thank you so much, Mayor Meek. All right, let's go now to McLennan County Judge Scott Felton. Judge Felton?
Good afternoon. To date, residents from 32 counties have registered for vaccines at the clinic. 87% of these appointments were among McLennan County citizens, and 13% were among out-of-county residents. A report showing zip codes that have been for people who have been served is now available on the covidwaco.com vaccine provider page. I might also mention that many of our residents have gone outside of this county for vaccines as they became available. Friends of mine went as far as Tarrant County this past week to get them, but hopefully we'll start getting enough vaccine inventory into this area that won't need to happen. With the Department of State Health Services designation of McLennan County and Waco McLennan County Public Health District as a vaccine hub, we are very clearly designated as a regional vaccine provider. There is no requirement for someone to be a McLennan County resident in order to receive the vaccine at the Waco McLennan County Vaccine Clinic. We were designated as a hub because we have the ability to quickly provide vaccine to the community, and McLennan County is one of the 5 counties in the trauma service area M, which continues to be a highly impacted area by the COVID virus, and with high percentages of patients in the hospitals at this time. The service area M is made up of McLennan County, as well as Coryell, Hill, Limestone, and Falls County. We will continue working to get the message out to our community to make sure the residents are able to utilize these clinics, and we'll continue to communicate with the Department of State Health Services to access the need for additional vaccines, our vaccine allotments for our community. We have received some questions about long-term care facilities within McLennan County and their access to vaccines. These facilities have contracted directly with providers in the Federal Pharmacy Partnership for Long-Term Care program to administer the vaccine to residents and staff on site. And these entities are not required to report their vaccination data to the health district, but we feel strongly that a high percentage of these people have received the vaccine. The large vaccine clinics is great news for our community, but please remember, if you're unable to get an appointment at these clinics, then there are other providers in the community that will continue to receive vaccine allotments as well. You can access that to covidwaco.com, and you will see a list of those people, and also the eligibility guidelines and frequently asked questions and maps of the vaccine providers. I know sometimes there's a lot of frustration comes about trying to get in those lines to get vaccinated, but just want you to know that we're doing everything we can, both from a standpoint of showing the state that we have the ability to run a hub, and as well as the amount of folks that are pitching in and volunteering to help us make sure we can deliver. Thank you.
Thank you, Judge Felton. Let's go to Dr. Jackson Griggs, CEO of Family Health Center. Dr. Griggs?
Thank you, Larry. And I'm going to start my comments with some extemporaneous words of gratitude. Right now, particularly in this moment when we're seeing the vaccines begin to materialize in our community, those words of gratitude really are directed towards Mayor Meek and the city manager's office and Judge Felton and his team as well, both at the city and at the county level. Just seeing tremendous leadership as we get this vaccination operation up and going. Just for the public, a word of my own private observation is this is so much more complicated than I would have assumed going into this. There are so many moving pieces, and the kind of orchestration to get this done is pretty massive. And so I'm just grateful for good leadership, and I share the hope that's already been expressed that with some diligence right now, and with the whole community sort of spreading the word of how important vaccination is, we will get our community to we will get our community to the herd immunity level, and we'll see incidence drop, hospitalization, and ultimately death decrease. Now to the numbers. McLennan County has seen a total of 21,407 confirmed cases to date. 1,303 are currently active. As of this afternoon, the Public Health District has received notification of 111 new cases of coronavirus. 163 people are currently hospitalized with COVID-19, and 27 of those patients hospitalized with COVID-19 are requiring ventilator support. And fortunately, we have no new deaths to report today. We've now seen a total of 315 deaths in McLennan County to date. Within elder care facilities in McLennan County, there are currently 15 facility outbreaks. There are 24 active cases among patients and staff in these facilities, and there have been 120 nursing home associated COVID-19 fatalities to date. And just for clarity, that is 120 of the 315 that I mentioned previously. That is not an additional 120, obviously. The county jail, there are currently 8 active cases. There is 1 current church-related outbreak identified within McLennan County. There are 12 independent school districts and 3 private schools that are reporting cases on campuses. And there are a total of 56 school campuses with active cases. Within schools, there are 188 active cases, and 121 of those are students and 67 are staff. Let me share my slides now that show us where we are in terms of incidence and positivity rate as they compare with state and country. Again, new cases per day per 100,000 population on 7-day rolling average. What you see here is that the state and the nation continue to climb in incidence numbers to previously unseen heights, and McLennan County, maybe since early December, maybe the second week of December, we've remained relatively flat with only maybe a slight increase in those maybe 6 weeks or so. 5 weeks, I suspect there's about 5 weeks there. So this looks really good compared with state and nation, but a couple things that I would remind you, the appearance is a bit deceiving because, one, we're still way above that tipping point that we described before, and could at any moment see further exponential spread. So things are tenuous in terms of new incidents, and so while the rate of growth in terms of new cases seems to have leveled off some, it does not mean that we can take a big sigh of relief and relax a bit. Now is the time for us to all double down, and I'll explain why here. One is our positivity rate is 22%, far above what it is at the state, and again twice what mitigation levels are, and so that incidence rate that I described before, might be artificially low. In other words, it may appear lower than it actually is because we're not testing sufficiently to catch all the cases that are occurring in our community, and we can tell that by the positivity rate. If our positivity rate was very, very low, we could rely on our incidence rates as being accurate. But given the high positivity rate, there's a pretty high margin of error around our incidence numbers. So, and then the other reason that it's time to really double down is represented in this graph here, that our COVID-19 positive patients admitted to Ascension Providence and Baylor Scott and White Hillcrest have been growing since early November, and I'll let the hospital leaders speak for their own systems, of course, but this growth concerns me, and the fact that we haven't seen a major leveling off, but we've seen only continued growth, speaks not only to the fact that there are more individuals who are taking healthcare resources for COVID, and so not the same healthcare resources, which are finite in number, can't be used for things like elective surgeries or other preventative measures. It also foreshadows death numbers that are in our future, and we can see the growth in death numbers on this bar graph here. We see that in December we had 84 total deaths, which is almost twice the highest previous month, and in January we've seen, and this is slide's a couple days old, but we have seen 29 deaths to date, so high numbers already in January. So again, masking, social distancing, avoid crowds and clusters are just critical factors. Finally, there's a publication, a journal called The Lancet. The Lancet's consistently one of the top 4 medical journals that we reference, usually very, very good research published in The Lancet. And on January 8th, there was a study that's the largest to date that's looked at the long-term consequences of COVID-19, and this shows at 6 months what those individuals who were hospitalized have experienced post-hospitalization, and what the results of this study. It's not a perfect study, and there are some. There's a critique of the study that's valuable that will occur in academic circles, and it might overestimate to some degree residual symptoms by some percentage, but I think that the core of the message is concerning, which is that there's a very high number of individuals who are hospitalized and then recover from the hospitalization, but have residual symptoms from COVID-19. This report that looked at 1,733 patients who were discharged from hospital in Wuhan from January to May, it showed that 76% of those who were discharged had residual symptoms at 6 months. This population who was discharged, let me reinforce, these were hospitalized patients. So these were individuals who were moderately severe with COVID-19, but it did exclude those who died or who were disabled and couldn't follow up with the study, and those who had other serious problems that made finishing the reporting structure of the study difficult. So these were those who were not the very, very sickest, but they were hospitalized. And the average age was only 57 years old in this population. And what the study showed is that the majority of individuals had some symptoms. 63 reported fatigue or muscle weakness, 26% reported sleep difficulties, and 23% reported anxiety or depression. So you might see this in lay media. Obviously, we'll be looking for further studies there, but this is worrisome both from the impact of quality of life for these individuals as well as the economic impact. You can imagine large number of individuals in our community being hospitalized and discharged and having residual symptoms. It could impact their ability to work or perform other job-related duties. So that concludes my report. Thank you.
Thank you, Dr. Griggs. Now let's go to Dr. Ahmad, Interim Chief Medical Officer from Baylor Scott and White Hillcrest. Dr. Ahmad.
Thank you, Larry, and thank you, Mayor and Judge. I want to echo the information Dr. Griggs was mentioning, that we do appreciate the city, Mayor, and Judge, and my partners up in both healthcare systems who are continuously 24/7 staying in touch through last many weeks in multiple platforms to find solutions not only to help the COVID, but also now how we are going to vaccinate our community. So the state of the hospital, which is not different from what probably Dr. Brian will share, we are at 100 to 110% capacity, but we are still working with our smaller regional facilities in our service area M so that we can get their patients who they cannot take care of them. So we are doing our best while we are struggling internally to accept the patients. We believe there has been a stability in the last 3 to 4 days. I would not call it a trend, but our numbers have been stable in-house. As Dr. Griggs mentioned, the use of ventilators have been low, which is a decent news from at least the sickness that we are seeing. We still encourage people to continue hand washing, socially distancing, and limit the gatherings outside the family. I do want to take the opportunity to talk about vaccination. We healthcare community has taken the vaccination ahead of the community, which is a sign of its safety. And we are the poster child for you guys to know that we ourselves have taken the vaccination to show you how safe it is. The second thing I want to highlight about the vaccination, while we are working how to provide the supply to the community with the city and locally and with our regional team members, is that immunity takes 5 weeks. You are not immune for 5 weeks still after the first dose of vaccination. So please do not miss the second dose, and please do not stop hand washing, social distancing, and also do not gather into a larger crowd. Even after you get immune, do not stop the practice. That's my only message, which I'm going to continue sending throughout the next couple of months. Do not stop the mask, even if you get immune with the vaccination. We have not seen even one admission after we vaccinated tons of thousands of people. Yes, there were a few side effects, and there were a few of them had an immediate reaction, but nobody got admitted. So it's a very safe vaccination. Please use our resources available to you. For Baylor Scott and White point of view, BaylorScottWhiteHealth.com/COVID vaccine is another resource for you to go online and get some information. And we are committed to providing vaccines and providing you guys the support which is needed. And that's all from me for the report.
Thank you, Dr. Ahmad. Now let's go to Dr. Brian Becker, Chief Medical Officer of Ascension Providence. Dr. Becker?
Thank you, Larry. And those were some great words from Dr. Ahmad. So thank you for that message on vaccines. I would agree. So we have diligently been working to vaccinate a group of people that are classified 1A, which are frontline healthcare providers. both in our organization and across the community. And we have had a similar experience, no significant reactions to those vaccinations, minimal side effects. We have had a cadre of folks who have now received their second vaccine as well, and no significant side effects in that group of folks either. So I would echo that. It is a safe vaccine. It does appear to be extremely effective and is a very good tool for us to get out in front of this. So thank you for those words, Dr. Ahmad. That's accurate. I'll speak to hospitalizations. So we certainly are reaching capacities in our hospital that we've not seen before. Like Dr. Ahmad, it's been pretty flat for a couple of days now, but flat means we have almost 100 COVID patients in our hospital, which is almost half of our normal licensed beds. So that's a significant volume of people. Within Ascension Providence, we are working out of our Surge 3 plan. So that's a pretty significant level of activity for us across our physical plant. We have patients in areas that we routinely don't care for patients who are here long-term. So again, as I gave last week, examples would be most of our recovery room after surgery, the recovery room, most of that is now ICU patients. Most of the area where people would check in on a routine basis for surgical procedures is now a med surg unit and housing patients that are inpatients. And we have gone to some areas in our hospital that traditionally don't have patients at all. And we are now taking care of patients in those areas. So while I'm encouraged that we've had a couple of days that have been flat, we are also really stretching the capacity to take additional patients. I want to take just a second to really try to emphasize the importance of everyone following those guidelines that have been placed for months now. If we look at vaccines as our ray of hope, and we're talking about giving 1,000, 2,000, 3,000 doses a week at the present time. If we accelerate that to 20,000, it's going to take us a couple of months to reach herd immunity vaccinating folks with first doses. And Dr. Ahmad just said we got to get a second dose in before we're immune. So while this is a silver lining for us, we still have a couple of long months in front of us as we try to get in front of this. The best thing that our community can do is really try to avoid social gatherings. Be sure you wear a mask. Be cognizant of where you go. And then when you come back home, what are you potentially exposing folks in your family circle to that you picked up while you were out traveling to the grocery store or to eat out? Those are areas where you could potentially contract the virus and then bring it home to your family circle. So it really is incumbent upon each and every one of us in the community to be aware of that. I've heard time and time again that I'm young and I'm not going to get sick and it's okay. And that may be very true. So certainly we see illness in younger patients, but we see significant illness in older patients. But that young person who doesn't get sick may well give it to someone who ends up in the hospital, who ends up in one of our ICUs. And those are then the folks that are taking up slots in our facilities that really begin to limit our capacity to deliver care. So I think it's important for each and every one of us to recognize that while I may personally not feel at risk, I may expose someone who is. And so if you would think of it that way and be really aware of your surroundings and be aware of how you interact with other folks, I think that's really important as we try to get through this next couple of months, get folks vaccinated and reach some level of normalcy. And then the last thing I would say is as I look at how it's impacting our community, it is easy for us to look at these numbers and say our hospitalization rates 30% in our trauma service area, and both hospitals are at or just over capacity, and that's true. But if we look at how does that impact the rest of our operations, neither one of us are really doing elective surgeries. Those are people who are sitting home who would otherwise need a joint replaced that's not happening, have a cataract that's not happening. And that is a huge amount of downstream effect. So we focus on our management of our COVID patients for sure, but it's impacting a much wider swath of our community. So look at it from that angle as well. We are not just impacting COVID patients. It is those people in our community who are forced to delay an elective procedure, if you will, that they would otherwise be able to get. And so for all those reasons, please wear a mask, wash your hands, avoid social gatherings, and get vaccinated when you have an opportunity to get in and vaccinate. Thank you so much, Larry.
Thank you, Dr. Becker. Well, let's go now to the media. We have 5 media representatives on the phone. We have Robin Geske from KWTX Channel 10. We have Rhiannon Sagert with Waco Tribune Herald. We have Shaquille Omari from Fox 44. We have Cole Johnson from KCEN Channel 6. And we have Joel Lopez from KXXV Channel 25. And we're going to go in that order. Each one of you will have a chance to answer 2 questions. We'll do 1 round, and then we'll come back and pick you up for the next one. So when I call your name, unmute your mic and ask your question, and then return to mute, and we'll come back to you again. So we'll go to Robin Geske with KWTX Channel 10. Robin, are you on the line?
Yes, I am. Can you guys hear me okay?
We do. Go ahead.
Okay, I just wanted to ask my first questions. About a couple days ago, Bell County was notified that they were going to get their shipment. They got their shipment. They started them today. But Coryell County was notified that, like, on the same day, that they were not going to get any vaccines at all this week. How worried are you guys about our supply here in McLennan County, that the vaccines that are promised that are actually going to arrive, when they say that they're going to?
I'll take a stab at that, and then if anyone wants to jump in and correct or make any adjustments, feel free to do so. Let me say, for all questions related to the vaccines, some of our experts on this subject matter are running our vaccination clinic right now and not present because they are tending to that very important matter. So to the extent that we don't know an answer, we will or there's more information than what I have. We'll certainly follow that up with each of the reporters on this line today. But to date, we have been told by DSHS that we will be getting additional vaccinations, and so we will move forward under that assumption based on the conversations we have had with them, knowing that this is a fluid situation and that anything can change. We will continue to advocate. We will advocate for McLennan County to get vaccinations, knowing the situation that exists here, knowing our hospital capacity, our positivity rate, as well as just something as true as the fact that we have the number of remains on a refrigerated temporary morgue, and other data points that illustrate the dire need for rapid vaccinations in McLennan County. So we'll continue to advocate strategically to ensure that decision makers at the state level know of the situation here, while also at the same time respecting how fluid the process is.
Okay.
And if there's anyone else who wants to add anything, feel free to do so.
Okay, Robin, thank you very much for your question. Let's go on to Rhiannon Sagert with Waco Tribune Herald. Rhiannon, you on the line? Hold on a minute. We're going to get you unmuted here. All right, now, you're on the line?
Yes, thank you. I had a question about the hospitals. You mentioned that hospitals were both sort of struggling internally and have recently sort of reached a level of stability in the last couple of days. Is that due to more cases in the rural hospitals coming in, or are they coming from a different source?
I'll take a shot at that, Rhiannon. I'll tell you, I don't look at the source of the patient on a daily basis. So what percentage of our hospitalized patients are McLennan County patients versus those that come from one of our contiguous counties? I don't know that I have those that hard data to relay. We, as Dr. Ahmad said, continue to try to be a good partner to our regional hospitals. And when they reach out to transfer patients to either of us, we look at what is our capacity, where can we stretch, where can we put another patient, and make every effort to accept those transfers when at all possible. There are instances where we simply don't have anywhere to put another patient as a transfer coming in from one of those facilities. And we'll tell them we can put them on a wait list. As soon as something's available, we reach back out. And they are then referred to a state line where they can seek assistance across the state for a site to transfer those patients to. And they do, from time to time, have to utilize that service as well. Both of our corporate entities also allow us to offload patients. So in the Baylor Scott and White system, it can be to Baylor or to Scott and White facility. For us, it's an Ascension facility. I would tell you that the places where both of those corporate entities reside are also experiencing a surge in patients and are experiencing their own set of difficulties as well. So that's gotten a little more difficult to utilize that avenue. So, Rihanna, I don't know if that's a great answer for you. It is. We haven't replaced our McLennan County residents being admitted with those from the contiguous counties. It's still about the same mix for us as it has been for some time.
Okay.
And I agree with Dr. Becker, everything he said.
Okay. Thank you, doctors. Thank you, Rihanna. We'll be back to you in a minute. Shaquille Omari with Fox 44. Shaquille, are you on the line?
Yes, I am. Can you hear me?
Yes, we do. Go ahead.
Okay, so my question is that I saw you guys established a hotline. My question is, what prompted this, and what's the feedback or any challenges you guys are facing with this hotline?
I'll take a stab at that. And the basis for the hotline, and Larry, you might be able to jump in here too, but the basis for the hotline is really just to really extend communications in every way that we can, continue to be proactive, creative, and strategic about how we are making sure that there's clarity in a situation that is inevitably chaotic, where there is much misinformation and difficulty in navigating, finding answers. I think having a hotline like this is a trusted, safe place where people can go and get answers to hard questions that might be hard to find. The internet is a great source for this information. Our covidwaco.com page, I think, continues to be the best source. But I think that sometimes people are more comfortable on a telephone. And it was with that in mind that we proceeded here. Larry, who is our very integral in this, might have something to add to that.
Well, I guess the primary reason is we did not want to overlook any communication network that we have, and there are a very, very small number of people, but they do exist, that don't have internet, they don't have email, they don't have the digital formats that we're used to having. So the phone is certainly something everybody has, and we had that hotline and we wanted to put it out there, and that does allow the option, press 1 for English, press 2 for Spanish. So that will be updated to match the covidwaco.com information that's put out daily if it's there. Exactly right. Okay.
I'd like to make a point, Mayor, if I could.
Please.
A lot of the calls that we received are from people who don't utilize all the ways to access information that maybe you and I do. But I want to take this opportunity to thank the media for having very good coverage of what's going on. Our local channels are very important to our situation here. And so, putting this phone number up is helpful. And even people on this that are watching us today, if they would write that number down and have it available when people that they know that do not access internet or other social media types would have it as well, so to help them figure out frustrations and not knowing where to go to get help. And we can ease that a lot by really blasting this information out on how to for them to achieve what they're trying to achieve, and either getting themselves vaccinated or family members. Thank you.
Yes, and
Totally agree with that. And just one more time, that number is 254-750-5606.
Appreciate that. Thank you very much. Okay, Shaquille, we'll be back to you in a moment. Cole Johnson with KCEN Channel 6. Cole, are you on the line?
Hi, yeah, can you hear me?
We sure
Yes.
do. Go ahead.
Okay, perfect. So Dr. Ahmad was talking about the immunity and the gap between when you receive the vaccine and when you actually start to develop that immunity. My question really is there any concern about potential spread or a potential spike in that gap period where people may feel that they got the shot and that they're immune, but they still don't have that immunity and could be spreading it? Is there a concern amongst the officials or amongst the medical professionals about that?
I'll take that answer. I don't think we have discussed that, but that's a fair question. That's why we are gonna get ahead of the curve in using every tool, every media source that we have to educate our community members that you don't get immunity on day number one. Having said that, once a person has some sort of immunity, that even if God forbid the disease comes through, they are expected to be less sicker than without any level of immunity. So we are hoping that we would not see a significant spike in between with education and with some level of immunity that they will develop in between. Anybody else would like to add, please? Go ahead.
Anyone else? Okay. Thank you, Cole. We'll be back with you in a moment. Joel Lopez with KXXV Channel 25. Joel, are you on the line? Joel, hold on. We're going to unmute you.
Can you hear me?
Now we hear you. Go ahead, Joel.
There we go. Hey, so I guess my question would be, despite all of our best efforts, we're still continuing to see cases increase here. So do we know why? Are these post-holiday surges? Are we seeing any kind of trend that could be causing this?
Dr. Griggs, do you want to take a stab at that one?
We did see a delay after Thanksgiving across the country. Here in our community, the Thanksgiving surge was not as pronounced as we saw in other areas. So I think that the jury's still out as to the impact of the Christmas holidays. Again, so much for us is uncertain because of the high positivity rate. It's really difficult for us to really pinpoint what's happening in actual incidents because, again, our positivity rate is 22%. So if we could get all of those folks who have mild symptoms, who maybe earlier in the year were tested and negative, and when they had mild symptoms, and this time they're thinking, well, it's just a little bit of a little fatigue, little body ache, a little scratchy throat, little night sweat. I'm not too worried about it. Last time I had the same and I was negative. If we could get all those individuals to go get tested just as soon as they have any even subtle symptoms that might suggest that they have the novel coronavirus infection and get those diagnosed. Heck, if we could get all those individuals who think that they might have been exposed to someone who who's had COVID-19, or even just who have been in circumstances that put them at high risk, then I think we could lower that positivity rate, get a more accurate idea of what our incidence is, and then the numbers would more accurately tell the story. Right now, with a big margin of error, it just makes explaining the pattern quite a bit harder.
Okay, thanks, Joel. We'll be back with you in a moment. Let's start a second round now. We'll go to Robin Geske with KVTX Channel 10. Robin, do you have another question?
Yes, I was wondering about, I know y'all said earlier that y'all were not like checking residency as far as, are you, living in McLennan County? Is it because y'all are servicing other like trauma service M? Do you have to live within that group in order to be vaccinated in Waco, or is it kind of like a statewide thing?
Judge Felton, do you want to take that one?
Yes, there's no restrictions on location or where you're from to go to any of these different vaccination hubs. As mentioned before, there's 28 hubs around the state, and that's kind of part of the deal. You take whoever comes in there. We've got people going to other areas for for their vaccination, and we've got people coming into this. But as I pointed out earlier, there's 87% of the ones that we're vaccinating are from McLennan County. I think as the supply gets larger and it spreads out through the state, people are going to go back to the old convenience, whichever the one's closest. And, hopefully we'll have enough vaccine to cover, the state. But right now it's real tight.
Okay, thank you, Robin.
And the one thing I would add to that is just that our communications team is going to continue to work hard and diligently and strategically to ensure that McLennan County residents are informed of the opportunity to register and to sign up and be given excellent access to this.
Okay. Thank you, Robin, for your question. Let's go down to Rihanna Sagert with the Waco Tribune Herald. Rihanna, do you have another question?
Yes, I had another one about testing. The community testing, has there been a noticeable decrease over time? Have people just stopped using those as often, or is it just a matter of the positivity rate being so high that people haven't really stopped? It's just that we desperately need more people to take that test.
Jackson, do you have that data available, or Kelly Crane is on the line? Kelly, do you want to take that one?
Well, I can tell you as far as the frequency of people using it, we have over 700 people testing every day. So there's still a high demand with our community testing, and that's why we're still offering it. So in terms of people are utilizing it, we're seeing a lot of people still have that need.
Thank you, Kelly.
Okay, thank you, Rihanna.
I don't know about the trends, though. I don't know in terms of how it compares with 6 weeks ago. Obviously, primary care is still a place where folks who have symptoms can seek testing, and in certain situations, even if you're asymptomatic, getting a test through primary care. So if we were to reach a saturation point, even with public testing, we'd have other options. And so right now, there's no barrier to getting tested. So the message to the public is just get tested in any way that you can.
Okay.
I have an additional factor which may be playing a role, because both hospitals have cut down their elective surgeries. We used to do a lot of asymptomatic testing for the elective surgeries, and that might have also contributed to the increased uptake in the percentage.
Good points, good answers. Thank you. Okay, thank you, Rihanna. Let's go now again to Shaquille Omari with Fox 44. Shaquille, do you have another question?
I do not. Thank you.
Thank you very much for joining us today. Cole Johnson with KCEN Channel 6.
Yes, I have a question, and if it's not able to be answered, I have a backup. So this was Dr. Ahmad also spoke about that they saw a few immediate reactions with the vaccine. Can you specify what those reactions looked like, if you're able?
Yes. I'll let Dr. Brian take also a jab at it. But from our point of view, it was mostly itching. Only 1 out of 1,000 had a swelling of the throat, a little bit of anaphylactic, but with the emergency treatment taken by the ER, we took care of them. And a handful of them, other people also had just a little bit of more soreness, locally more than we have been seeing. And those are the handful of reactions we saw immediately in the first hour or two.
Okay, thank you very much. The final question goes to Joel Lopez at KXXV Channel 25. Joel, do you have another question?
Yeah, I do. My question is for Kelly Crane. Hey, Kelly, so we spoke this weekend when we got that 1,500 doses of Moderna vaccinations, and we were hoping that this is going to be a regular reoccurring thing. I just wanted an update on that. Do we have any word on if that's a possibility or when we can see another mass vaccination event?
Well, I know that the judge and the mayor have also talked about that. DSHS has committed to providing us with more vaccines as one of the 28 hubs. So as a health district, we are preparing for the next round and the next vaccination clinic whenever we get those doses. We're going to continue to send out information to the media, let everyone know, give people a heads up on when they can register. But right now we're moving forward as if we are going to receive vaccine.
Okay.
Got it. Thanks.
Thank you all. Thank all 5 of you for being here. And I want to take the opportunity, like the judge said, as well as the mayor. I thank the media for really getting actively involved and giving good, accurate reporting, checking details before putting something out, because that's so important in the communication that we're dealing with, that we give correct, accurate information in all areas. I want to thank you for that. Okay, we're going to wrap that part up. And Mayor Meek, we're going to let you make the closing comment here if you'd like to. And then I'll wrap it up and we'll get out of here maybe within an hour.
A lot of good information today. I thank every panelist on this call for their time, and I want to thank their institution's efforts to just be a great community partner, caring for our community. And one way that these institutions do that is by allowing each of you to give your time. So thank you for all the work from our hospital system, Family Health Center in the county, as well as the city. I do want to give one last thank you, and that is to our city manager's office, Bradley Ford, Deidre Emerson, Ryan Holt, Paul Kane, Galen Price, as well as our city legal department, Jennifer Ritchie and her team, and Esmeralda Hudson, our city secretary, and her team, and Larry, who moderates this panel. To all of those who put so much time, energy, and effort, Ashley Nystrom, as well, in the city manager's office, to all of those who put so much effort into ensuring that this press conference goes smoothly. Thank you. And thank you for everyone's time today. We'll be back next week to bring some more information to you. Have a good day.
Yeah, I want to thank all of you all for being here, a part of it as well. I want to remind everybody that the Spanish translation will be this afternoon at 4:30, and we'll also have a full replay of this at 7 o'clock, but it's always available online, so you can take it directly anytime and play it on demand. Nothing was mentioned today about the flu shot, but we need to remind everybody to get the flu shot. That's something that's out there that still is a part of the medical world that we have to deal with. And always remind you that covidwaco.com is the source to go for correct information. There you can sign up for an e-newsletter, which if you're wanting to get a notice of any new vaccines coming in the community, when you can register, sign up for that e-newsletter, because it will blast an email out to you letting you know the availability. So that's the way we communicate with you, to let you know that it's available. So we'll be back next week, like the mayor said, with another press conference with more information from these individuals that know the answers to it. We hope you have a great afternoon, and thank you for being with us.